Hi, Suzette here today with Johnston Health. Today we're going live with Dr. Eric Janis of North Carolina Heart and Vascular. We'll give everyone a few minutes to join and then we'll get started. So how did you do with your vaccine?
The vaccine went extremely well. It was very smooth. I had no problems. I've gotten both vaccines, and it is really quite amazing how much better I feel and
Already?
safer I
Yes.
feel.
Inspires confidence.
I still I still practice social distancing and wear my mask, especially, of course, when we're working with patients.
Mm-hmm.
And I still try not to go out and spend unnecessary time out in crowds. But overall, I feel much better. My family feels much better. My wife feels so much better knowing that I've been vaccinated, and so her risk has gone down tremendously. So the vaccine was easy. It did not hurt at all. I think everyone, I don't know, I've known obviously lots of people who've gotten the vaccine. Nobody's had a problem. So you're hearing stories, of course, on the internet that people have had problems, but in fact, the absolute numbers of people who have problems is very small.
Mm-hmm.
And I feel so much, I feel more confident and I feel safer knowing that I've had the vaccine. And certainly for folks out there, I encourage everybody to get the vaccine when it becomes available. It's very safe, it's very effective, and it will give you peace of mind and give your family peace of mind as well that you're doing everything you can to reduce your risk of getting COVID.
Absolutely.
It's
That's
really
great. That's
nice.
great. All right. It looks like a few people have joined us, so we'll get started. Good afternoon, everyone. Welcome to Johnston Health's second Facebook Live event. Today, I am thrilled to be joined by one of Johnston Health's finest, Dr. Eric Janis of North Carolina Heart and Vascular. He has been here in practice in our county and here at our hospital for more than 25 years. So first of all, tell us a little bit about yourself and about our cardiology program here at Johnston Health.
Thank you, Suzette, and welcome to everybody on Facebook Live. I'm Dr. Eric Janis. I've been a cardiologist here for about 25 years. I came here from Johns Hopkins and came here to Johnston County to help establish the cardiology program here. When I came, I was ready to get out on my own and take care of patients. And this is a great place that I wanted to raise a family and wanted to live and honestly make my mark. So been here for quite a while, and we have grown tremendously over the years. We've grown from one cardiologist to we have now 7 cardiologists right here in Johnston County. And we have 12 mid-level providers, that's nurse practitioners and PAs. We service both Johnston Health Smithfield and Johnston Health Clayton, and we're here 24 hours a day, 7 days a week. We've grown our program tremendously over the years. We now provide, of course, 24/7 cardiology care. We take care of heart attacks and strokes and irregular heart rhythms and heart failure, pretty much everything that any full service cardiology program provides. I honestly think that we provide care that is honestly as good or better than at any hospital or any institution in the country, but with something special because we are part of our community. And are dedicated to our community and dedicated to our patients. So I like to think that we provide the very best in cardiology care, but with the community hospital feeling. So
Well, we're glad to have you with us today to learn more. For those of you who just joined, I'm speaking here with Dr. Eric Janis of North Carolina Heart and Vascular. You know, heart health is such an important topic. We will be focusing more on it in February as we kick off our All in Red campaign. But first, we wanted to sit down with Dr. Janis today to learn more about the different types of heart disease, the signs and symptoms, and how we can prevent heart disease. What are the most common types of heart disease?
sure, Suzette. So the most common kind of heart disease that people think about is coronary artery disease or blockages, which can present with chest discomfort, chest pain that people often describe it as, or heart attack. That is the most common kind of heart disease that we do run into, and that is due to developing blockages in your arteries. There are many kinds of heart disease other than that. There's irregular heart rhythms. We see lots of people with atrial fibrillation or an irregular heart rhythm, which is a very serious problem and really does require cardiology care. We see congestive heart failure, which is a problem with retaining fluid and getting short of breath. See lots of folks with other kinds of heart problems, shortness of breath, that we have to evaluate for heart disease, other irregular heart rhythms, palpitations, and really anything that folks have that relates to their whole cardiovascular system. We do see lots of people with peripheral artery disease as well, which is blockages in the legs, and which can cause trouble with when you walk, where your legs get tired, or you have discomfort in your legs. Really, the whole gamut of cardiovascular care we look after here.
So, what are the signs and symptoms of heart attack? How do I know that I'm having a heart event?
So, a heart event is it's usually something that most people notice, but in fact, one of the interesting things about heart disease is that often heart disease is unrecognized. Up to about 1 in 5 patients will actually have a heart attack and not even know they've had it. And that's because heart attack symptoms can be very subtle. So the thing that you normally think about when it comes to having a heart attack is everyone thinks about, a middle-aged, overweight man who's clutching his chest and breaking out into a cold sweat. That's what we think about, but in fact, most people who are having heart symptoms don't have severe pain. We actually prefer to describe it as a discomfort. So most people with heart discomfort, it's not a pain like you can put in one spot, but it's actually a pressure sensation, a heaviness, a fullness. Often it's like a balloon is blowing up in your chest is a very common description. But sometimes people don't even have chest discomfort. They have shortness of breath. They can break out in a cold sweat. You can have discomfort going to your arms or your neck or your jaw or your teeth. All of those things can be signs of heart disease.
So, how does it affect women differently than men?
So what's very interesting is we've come to realize that again, while the classic picture of someone with heart disease is an overweight man clutching his chest and breaking out in a sweat, women are at the same risk of getting heart disease as are men. And that is one of the reasons that we're doing our Facebook Live coming up for our All in Red campaign. February is Heart Month, and specifically to help women understand that they are at risk for heart disease just as much as our men. But women often present differently than men when it comes to heart disease. So women are much more likely to develop just shortness of breath, so that people will say, I'm getting short of breath when I walk to the mailbox, or when I go shopping, I have to stop halfway through because I'm losing energy. I'm getting short of breath. Women do get chest discomfort as well, but sometimes it's not the classic chest pressure here. Often, and we see this quite frequently, women will complain of discomfort between their shoulder blades when they walk. They think, oh, I'm just having arthritis or something like that. But in fact, if you're having discomfort almost anywhere, which is worse when you walk and do stuff, we worry about that could be a sign of heart disease. But shortness of breath, fatigue is one of the things that is a real big complaint for both men and women, but even more frequently in women, that I just get tired doing things. When I'm cleaning the house or making the bed or doing laundry, I notice that I'm short of breath and I'm more tired and I have to stop and take a break. If those are the sorts of things that you do notice, even if you don't have chest discomfort, even if you think you're very healthy, it's really worthwhile to go ahead and talk to your doctor to be evaluated for heart disease. It happens, and it is common.
Which brings a good point about what do you do if you're having these symptoms? What's the thing to do?
So the things that we worry about, certainly if you have risk factors, and the risk factors for heart disease include things like getting older, advanced age. But we're talking in men, they start to get heart disease when they're in their 50s. Women usually start a little later, so that heart disease really starts to increase when women get over the age of 60. But high blood pressure, if you have diabetes, if you have high cholesterol, if you have a strong family history of heart disease, if you smoke, that increases the risk of getting heart disease. If you notice that you're getting short of breath when you do stuff, or you're having some discomfort either in your chest or in your back or your shoulder blades, you want to talk to your doctor if you have a primary care doctor. If not, of course, you can call us. I mean, North Carolina Heart and Vascular, and we're more than happy to make an appointment and see you. What we would normally do is we'd talk to you, talk about your risk factors, talk about what kind of troubles you're having. If we are worried about chest, blockage problems, we'll go ahead and set up a stress test and other evaluation to see if you might have heart disease. We're very good at treating it. We're very good at diagnosing heart disease, both in men and women, and it's important to recognize that you're at risk, and to seek medical attention if you're having trouble. It is not okay, and it really doesn't do anybody any good to wait and wait and wait till you're having trouble. I remember we had a young lady not long ago. She was 48 years old, a fitness instructor, incredibly healthy woman. She had a strong family history of heart disease, and she was noticing some discomfort. And she thought, oh, it's nothing. I'm doing too much exercise, or I'm having indigestion. And finally came into the hospital, and she had a 99% blockage on the front part of her heart. She would have never identified herself as someone who's at risk for heart disease, but she was having troubles, and fortunately decided that something's not right, and I better get it checked out.
So family history and age are two major things.
So
Something you can't really do about.
Yeah, there are things that put you at risk for heart disease that you can't do something about, and things you can do something about.
So the things that we can do about, what are some tips that you have for preventing? What can we do to prevent heart disease?
Absolutely. So smoking is one of the top risk factors for heart disease, and if you do smoke, stopping smoking reduces your risk of heart disease dramatically and very quickly. Diabetes is a major risk factor for heart disease, and in fact, diabetes is more of a risk factor for women than it is for men. So a woman with diabetes has a 5-fold greater risk of having heart disease than a woman without diabetes. It's a big risk factor, and in fact, women with diabetes can get heart disease in their 40s and 50s. They tend to get heart disease at a younger age. So trying to avoid diabetes by watching your diet, keeping your weight under control, regular exercise is really important.
High blood pressure is another issue.
High blood pressure is huge, and during my career, I think I've come to realize the importance of high blood pressure treatment.
And a lot of us have high blood pressure. Is it what, 1 in 3 of us have?
Well,
high
I
blood
hate
pressure?
to say that in the United States, 90% of people over the age of 50 will get high blood pressure.
Oh, wow.
It is
Uh-oh.
incredibly common. A lot of it is diet related, a lot of it is exercise and weight related. But keeping high blood pressure under control not only reduces the risk of heart disease, but reduces the risk of stroke. It reduces the risk of congestive heart failure. It reduces the risk of atrial fibrillation. High blood pressure is one of those risk factors that you want to try to avoid or keep under control by watching your diet, keeping your salt intake down, trying to get regular exercise. And if you do take medicines, trying to be reliable about taking your medicines, and trying to keep that blood pressure under really good control. We also worry about cholesterol. Cholesterol is one of the major risk factors for heart disease and for stroke. And trying to keep that cholesterol as low as possible is actually very important. We do recommend diet, exercise, weight control to control your cholesterol first. If you have had heart disease, or if you are at high risk for heart disease, we often will treat cholesterol, and the benefit is incredible. Getting the cholesterol down in people who are at risk for heart disease can reduce your risk of heart attack by 50%. Simple things, keeping the cholesterol down, keeping the blood pressure down, avoiding diabetes, trying to get regular exercise are really important risk factors that you can control. It's felt that about 80% of heart disease is probably preventable.
Wow, that's a good segue to our next topic, our All in Red campaign. As I mentioned earlier, one of the ways in which Johnston Health and the Johnston Health Foundation helps create awareness of the importance of heart health is through its annual All in Red campaign. It's February 5th through the 12th. It's a countywide community engagement initiative aimed at raising awareness and raising funds for the Heart Fund, which I know you feel very passionate about.
Yes.
One of the ways that you can participate is by wearing red on February 5th, which is National Wear Red Day. There's some other things that you can do. You can share our daily heart health messages on social media. You can be a sponsor of our All in Red campaign. There are lots of other details you can find on our Johnston Health website / All in Red campaign. And I know that you are very important about the campaign. Do you want to tell us about your participation in it and your involvement?
Absolutely. The All in Red campaign is a national, it has been going on for a number of years, and it is a huge fundraiser to raise awareness specifically for regarding the importance of preventing heart disease in women and trying to raise awareness for women that they are at risk and can do things to reduce that risk. So All in Red Day Wear Red Day, I guess, is February 5th, but our All in Red campaign lasts the entire week. At johnstonhealth.org, you can find information about how you can participate. But our Johnston Health Foundation has been a major sponsor for the All in Red campaign, and we have a heart fund that is the recipient of any monies raised during the All in Red campaign. Last year, we raised over $57,000 for the heart fund for the Johnston Health Foundation. And we hope to raise even more this year to try to really raising money for what we have is a heart fund, and the heart fund helps those patients with heart disease get the medicine that they need, get to their doctor's appointments, attend cardiac rehabilitation, get some of not only the services, but some of the equipment that they may need to recover from their heart disease or to do their best to reduce their risk of getting more heart disease.
It can be very expensive.
So the foundation has done a marvelous job, and the Heart Fund has done a terrific job.
And last year you were our campaign sponsor, and this year Dr. Matthew Hook, our interventional cardiologist, is our sponsor. So we've had great participation.
We have, and Dr. Hook has done a terrific job. He's been the director of our cardiac cath lab and the director of our cardiology department, and he has built our cardiac cath lab over the last 5 years. We do 1,500 heart caths and defibrillator procedures and other procedures in our cardiac cath lab. And the purpose, there are people out there who have heart disease and don't have the resources. Medical care, medicines are very expensive. And we have access to the money in the Heart Fund from the Johnston Health Foundation to help those people get their medicines and keep their doctor's appointments.
Wow.
And get what they need to stay healthy. So it's a huge campaign for those folks who are interested in giving. Of course, there are many ways you can participate. Again, go to johnstonhealth.org and you can search on the link for the All in Red campaign. If you're interested in giving, johnstonhealth.org, of course, is happy to accept donations from the community for the Heart Fund or any of our other funds. We have wonderful programs, a Healthy Kids campaign
That's right.
to help kids work on preventing heart disease. Of course, we have the Angel Fund for our
Mhm.
oncology department, and luckily we are doing a campaign now to an outreach to facilitate outreach to our community.
Right.
So
Lots more to come on
we're
that.
actually hopefully folks will be
Right.
excited to participate in that as I
Exactly.
am. We're looking to raise funds to get a mobile
Mhm.
a bus to
Right.
go out to our communities and to provide medical care and preventative services where people live so they don't have to travel.
Yeah, that's awesome. So exciting. While we've been talking, received a few questions. One of them is, how do I know if I should see a cardiologist? That's a great question.
It's an important question. So again, if you notice that you're having troubles, if you're having shortness of breath when you do stuff, if you notice that you're giving out or can't quite do what you used to do, that could be a sign of heart disease.
Mhm.
Obviously, if you're having chest discomfort, pressure sensation, again, back discomfort, arm discomfort, especially when you're doing stuff, that really requires seeing a cardiologist. If you've noticed your heart racing or fluttering or palpitations, we see that commonly, and it's actually kind of important to see a cardiologist to make sure that you're not having any irregular heart rhythms.
Mhm.
Of course, if you're having dizziness or lightheadedness or fainting, those are things that are also very important to see a cardiologist about.
And then if you have a severe event, you need to call 911. Is that right?
So the first thing you do, if you are having a heart attack, if you are having a major problem, the first thing that you do is call 911. Early treatment for a heart attack or a stroke or even atrial fibrillation can make a huge difference. You don't want to sit at home saying, "Oh, I'm having really bad indigestion, eating Tums all night," or saying, "Oh, I'll just wait till the morning." If you're having real trouble, bad chest discomfort, bad shortness of breath, bad dizziness, it is absolutely best to call 911 and get seen as quickly as possible.
I have a fun factoid. I know that I recently talked with our EMS folks, and on average, they can get to you within 8 minutes and 23 seconds. So that is about the time it would take you to find your shoes, put them on, and get in the car. So you're better off to call 911.
Absolutely. We know that the earlier you treat a heart attack, you could make all the troubles with heart attack go away if you get it treated as quickly as possible.
We have another question. What should I do if I'm with a friend or family member who looks like they're having a heart attack?
Excellent. So the first thing, so if you notice someone saying, "I don't feel well, I feel uncomfortable, I'm hurting, I'm short of breath, I'm breaking out in a sweat," 911 is the first thing to do. It is the sooner you can activate 911, the sooner treatment can get started, and the sooner you can get to the place you need to be. You want to, if someone's having a heart attack, taking an aspirin can actually make a big difference. And it's the first thing that the EMS will do, or the first thing we'll do if you arrive at the hospital. The standard teaching, you want to take 325 milligrams of aspirin, a full aspirin. We will often give you 4 baby aspirins and have you chew them up.
Mm-hmm.
You want to make sure that their heart attack, someone who's having a heart attack is sitting down or laying down and at rest. Try to make sure they're breathing okay. I do encourage people to learn CPR. It can make the difference between life and death, just knowing how to do CPR for even a short period of time.
Right.
Obviously, if you're in public or you have access to a defibrillator, you want to call 911 first and then do whatever you
Right.
feel comfortable doing. But really getting immediate medical attention is the number one thing that you want to do.
And Johnston Health is accredited chest pain centers, so that means that our emergency department staff and physicians know exactly what to do for chest pain when you arrive.
That's correct. We have a fully accredited chest pain center both here and in Clayton, and of course we have a heart cath lab that is capable of taking care of a heart attack by going directly to the cath lab and opening up that blocked artery. Yeah, we have great staff, great team. If you come into the ER with bad chest pain and they think you're having a heart attack, we'll have one of our cardiology team down there within 5 minutes. And if you need to be taken care of, we will have you in the cath lab within 10 minutes. I mean, our team here in the emergency department and the whole system, the whole hospital is geared in to take care of heart attack patients very quickly and very efficiently.
Because time is muscle. Here's another question. How does my family history affect my heart health or potential for heart disease? That's a good one.
It is a very good one and very important. So, a family history of heart disease, in our world, we define that as if you have a male family member with heart disease younger than age 50 or a woman with heart disease younger than age 60. That's how we define it. If you have that, your personal risk of having heart disease doubles, so it increases by twofold. And it can be inherited, heart disease can be inherited through your cholesterol. So if your family member has really high cholesterol, you may have inherited really high cholesterol, and we can reduce your risk of heart disease in that way. But there are a lot of other genetic factors that we don't understand, but we do know that if you have a family history of heart disease in one of your direct relatives, mother, father, brother, sister, it does put you at increased risk. And you want to do everything you can to prevent it. So I like to tell people that even though many members of your family may have had heart disease, it does not have to be your destiny to have heart disease. You can prevent it. We can work with you to try to prevent you from getting heart disease yourself, even though your other family members may have it.
That's a great point. We have another question. Here's a very pertinent question. Does COVID-19 have a negative impact on your heart?
COVID-19, as you know, has been a quite unexpected illness and affects the entire body in many, many ways. The heart has been particularly affected. It's very interesting how in the early days of the epidemic, the heart manifestations were a little different than they've been over the last couple of months. So early on in the COVID outbreak, we were seeing a lot of heart attacks. And we're seeing a lot of people getting what looked like a heart attack, and it could be blockages because COVID causes lots of blood clotting in the little blood vessels, and so people were getting heart attacks from little blood clots. They were also getting inflammation from the infection itself was causing a lot of inflammation around the heart. More recently, we've actually seemed to see less of the heart attack problem because we're treating COVID better. We're giving blood thinners when people get sick with COVID, and so it's actually reducing heart attack. But what we are seeing throughout this COVID epidemic is not the effect of COVID-19 itself, but the fear of COVID-19 itself. So we are seeing a dramatic drop across the country in people seeking medical attention in the emergency department or in the doctor's office or in the hospital because they're afraid of catching COVID-19. The hospital is one of the safest places anywhere for patients who are worried about catching COVID-19. It has been quite dramatic, I think, to all healthcare professionals how few cases of COVID have been caught within the hospital. And it's because all of our workers have been incredibly aggressive about hand washing and face masking and distancing from patients in an appropriate fashion. Not only that, we test everybody who comes into the hospital. So there's no silent carriers of COVID-19 in the hospital. The patients are all tested. Everyone who comes to the emergency room with any symptoms at all is tested, so that your risk of catching COVID in the hospital is honestly a lot lower than your risk of catching COVID
in the grocery store.
I'd like to say that, but attending family gatherings, and going about your old life. Let me say that. So not seeking medical attention has actually been one of the really bad consequences of COVID-19. You look and you see that there are deaths from COVID-19, and then there are excess deaths. And there's been a lot of excess deaths in the United States during this COVID pandemic time, and that's because we think people are not seeking medical attention when they were previously. So if you're having a problem, please do not feel afraid to seek medical attention. It really makes a difference. If you're having chest discomfort, if you're having bad shortness of breath, if you're having racing heartbeats or dizziness or fainting, it is absolutely safe to come to the emergency department, come to the hospital, come to your doctor, and really important to try to do that. It's I would not let the fear of COVID stop you from getting the attention that you need if you're having real heart trouble.
And we have room for you too. We can make a space for you.
Absolutely, absolutely. No, if someone comes in with a heart problem, you are taken care of.
Right.
Period. Not a problem.
So we have another question. Do both hospitals have a cath lab?
Yes. Here in Smithfield, we do have a cardiac cath lab that does both heart caths and coronary interventions, so stents and balloons. We have another cath lab here in Smithfield that is dedicated to pacemakers and defibrillators, electrical studies, and also peripheral vascular disease treatment. We do have a peripheral vascular lab, a interventional radiology lab in Clayton. We're not currently doing heart patients there. Cardiac cath labs are strictly regulated by the Certificate of Need rules in North Carolina, and so right now we do not have a cardiac cath lab, but we do have an interventional radiology lab so that procedures can be done on legs and arms and dialysis catheters and other things. It is on the future horizon that we may get a cath lab in Clayton, but at this time, it's better to have a 24-hour, a full-service cath lab that does everything right here in Johnston County. And we've expanded that. So our cath lab here, our interventional lab, Dr. Hook has done a tremendous job. We've been taking care of heart attack patients. So heart attack patients that used to be driving 40 miles up the road, they come into our ER. Our cath lab is 100 feet from the emergency room. So patients can be wheeled right into the cath lab and get treated for their heart attack faster than they even get off Highway 70.
Dr. Janis, thank you so much for sharing your expertise with today. I know I learned a lot, and I hope our friends at home did too. If you enjoyed this conversation, please like and share this video with your friends. We'll be hosting more Facebook Live events like this again soon, so make sure you subscribe to Facebook Live notifications so you can join us again next time.
Suzette, thank you, and to all the folks in seeing on Facebook Live, please share with your friends. And remember the Wear Red Day on February 5th and our All in Red campaign from February 5th to February 12th. And you can find more details on how you can participate and how you can help at johnstonhealth.org and click on the All in Red campaign.
So have a great week, everyone.
Thank you.